maintain nutritional status and also to administer medication. So the assessment is we need to assess for any clinical signs of malnutrition or dehydration, and also for allergies we need to any food in the feeding. If the client is lactose intolerant, we need to check for feeding tube feeding formula. And then notify the primary care provider if for any incompatibilities exist. And then after that is we will now plan or in planning. Before commencing a tube feeding, we need to determine the type, the amount, and the frequency of feeding and tolerance of previous feedings. So after that is we need to prepare the following equipment such as the correct type and amount of feeding solution, the 60 ml catheter. For example, this is our 60 ml catheter, our MSS basin, our clean gloves, pH strip, and our large syringe. For example, this is our large syringe because we don't have any syringe at home or large syringe at home. And I wasn't able to go out. And then also we need to use a measuring container and then water with 60 ml. And then after that is we need to always understand that do not add colored food dye to tubings because it may cause adverse reaction, or the patient might have adverse reaction from the dye. And then also we need to assist the client to a Fowler's, semi-Fowler's, or to a Fowler's position at least 30 degrees elevation. So we already put our client into a Fowler's position, and then also this position enhance the gravitational flow of the solution, and also it can prevent aspiration of fluid in the lungs. And then also we need to introduce ourselves and verify ourselves to the client. So, good day, I am Nurse Michelle, your nurse for today in UR. Okay, and then after that is we will explain to the candidate what we are going to do. So I will be performing nasogastric feeding or nasogastric feeding to you. And then also we will be needing to perform hand hygiene. So after performing hand hygiene, we will now put our clean gloves. So after putting our clean gloves, we will now provide privacy. So this procedure may be embarrassing to other patients. So if the patient wants to close the doors and windows for privacy, might as well do so because it is for their comfort. Next is our implementation. So implementation is we need to assess the tube placement. So we already applied our clean gloves, and then also we need to attach a syringe to open end of the tube and aspirate. So for example, this is the open end of our tube, and this is our syringe. And then also we will put our syringe to the tube. That. And then we will check the pH. So we will aspirate here, and then we will check the pH. So we need to allow at least 1 hour to elapse before testing the pH if the client has already received a medication. So use a pH meter rather than a pH paper if the client is receiving a continuous feeding. So we need to follow the agency policy if the pH is equal to greater than 6. So this is our pH strip. So we will be putting the gastric juices in our strip to check if the pH is in normal range or if the patient is not acidic. And then after that is we will now assess the residual feeding contents. So if the tube is placed into the stomach, aspirate all contents and measure the amount before administering the feeding. So this is done to evaluate absorption of the last feeding. So that is whether undigested formula, evaluate absorption or undigested formula, or also from a previous feeding remains. If the tube is in the small intestine, residual contents be aspirated. And then also if 100 ml or more than half of the last feeding is withdrawn, we need to attach this with patient's head when we insert this, right? So after we inserted this, that's when we will aspirate for checking of the pH. And again, I will be doing it. So this is our injection or our syringe. We will aspirate. And then we will check for the pH. And then after that is in po, if 100 ml or more or we are done to that, reinstill the gastric contents into the stomach if this is agency policy or primary care provider's order. So the removal of the contents disturbing the patient's electrolyte balance. So we will extract it. For example, we will saw if the patient is on continuous feeding, check the gastric residual every or according to agency policy. And then also we need to administer the feeding. Before administering the feeding, check the expiration date of the feeding. So for example, our feeding was already here, and then the expiration date is 2023. Also, we will check for our clients' abdomen. So it is not as soft as normal, so we will now we will be doing our nasogastric tube. So after that is we will now warm the feeding to room temperature. So an excessively cold feeding may cause abdominal cramps. That's the reason why. So when an open system is used, clean the top of the feeding container with alcohol before opening it. For example, we will clean the top with alcohol swab. So this minimizes the risk of um, contaminants entering the feeding syringe or feeding bag. So feeding bag is the open system. So apply a label that indicates the time of starting. So for example, this is our feeding bag. For example, this is our feeding bag. And then also, we need to apply the label that indicates the date, the time of starting, and the nurse initials in the feeding bag, and then hang the labeled bag from an infusion bowl, about 30 cm, and then above the tube's point insertion of the line. So all of this height, the formula should run, for example, we're gonna put it here. There. And then also we need to clamp the tubing and add formula to the bag. So open the clamp and run the formula through the tubing and reclamp the tube. Then the formula will be displaced in the air tubing, thus preventing installing air and from the for example, this is our bag. This is our bag. And then we need to attach the bag to a feeding tube and regulate the drip by adjusting the clamp. For example, this bag has a clamp here. For example, 22 drops per ml. If not placed on a pump. And then also, we need to um, use the syringe if the open system naman. So, when it's open system, when we are using open system, remove the plunger from the syringe. Remove the plunger from the syringe and then pinch or clamp the nasogastric tube. Pinching or clamping the nasal cavity prevents the excess air from entering the the stomach. And then also add the feeding to the syringe barrel. For example, so we will be extracting the formula, and then after that is we will permit the feeding to slowly flow in a prescribed rate. So raise or lower the syringe to adjust the flow as needed. So pinch or clamp the tubing to stop the flow of for a minute. Yeah. So pinch or clamp the tubing to stop the flow for a minute. So instill 50 to 100 ml water through the feeding tube. Rationale is to flushes the lumen of the tube, preventing future blockage by sticking formulas. So for example, I put water here, then we will be using 50 to 100 ml. We will flush. So we don't need to worry because if the client is NPO, um, he really needs water. Be sure to add water before the feeding solution has drained from the neck of the syringe for the tubing or administration set. And then also adding the water before the syringe or tubing is empty prevents installation of air into the stomach of our patient and or intestine, and thus prevents unnecessary distension. Next is we will now clamp the feeding tube. And then after the feeding is complete, cover end of the feeding tube with plug and clamp. So clamp the feeding tube before and the water is instilled. So for example, this is the clamp of the feeding tube. And then ask the client to remain sitting upright in the Fowler's position so that this position facilitates digestion and movement of the feeding from stomach along the alimentary tract and prevent the potential aspiration of feeding into the lungs. So we already clamp our feeding. Next is we will dispose the equipment appropriately and then remove and discard the gloves, and then we will now perform hand hygiene. And then after that, we will perform follow-up examination of the following: tolerance of feeding, such as nausea and cramping, bowel sounds, regurgitation, and feeling of fullness after feeding. Also, we need to check for weight gain or loss, fecal elimination patterns, skin turgor, urine output, and specific gravity, glucose and acetone in urine. And then, also, the documentation, we need to document all relevant information. So document the feeding, including amount of kinds of fluids administered, and then record the volume of the feeding and water administered, and then report any significant deviations from normal to the primary care provider.